Audio Jungle.
Welcome to another Dr. Stu Health Mastery series. We will make medical information digestible by informing you, educating you, and help you along that journey to become masters of your own health. Now, remember, whatever is said here is general advice, and if you have any questions about any symptoms you may be experiencing, you should always see your own doctor, your GP or your physician, to get an advice that's tailored for you, so you can be managed in the most optimal way. Now, I'm wearing a t-shirt today because of what I want to discuss with you. What I want to discuss with you is how to measure your blood pressure at home. Now, measuring blood pressure is quite important, and in the current pandemic, a lot of patients are not being seen regularly at their GP surgery or in hospital, and so physicians are increasingly relying on our patients. I rely on my patients quite a lot to do their blood pressure reading at home. But look, even if we're not in the pandemic, it is really, really important to be able to measure your blood pressure well and accurately at home. And I'm going to go through, the steps, what machine to use, how to actually measure your blood pressure, and what some of those readings might mean. Let's talk about blood pressure. What is blood pressure? Blood pressure is a pressure within your arteries. Okay, so we have, as you probably know, we have arteries that take blood away from your heart to your vital organs, your brain, your kidneys, your liver. But also there's some arteries that take blood to the heart itself. Okay, these are the arteries that get blocked and then cause a heart attack. And then you've got your veins, which return blood to your heart. Now, the pressure within your arteries is your blood pressure. There are normally two readings that you get. A higher reading, which we call the systolic blood pressure. And this is essentially the pressure within the arteries when the heart contracts. Then you have a lower reading, which is a diastolic pressure. And this is the pressure within the arteries when the heart is in a relaxed state. As you know, our heart beats when it contracts to squeeze blood out. That gives us our systolic pressure. And when it's relaxing, we get our diastolic pressure. There are normal readings for both systolic and diastolic. Normal blood pressure should be less than 140, so a systolic of 140, and less than a diastolic of 90. Now, the lower your pressure reading is, the better it is. Now, if your blood pressure reading is greater than 140 and 90, it doesn't necessarily mean you have hypertension. It means you may have hypertension, and there are ways that we go about diagnosing hypertension. You may be fit and healthy. Okay, you may not have an underlying health condition of any sort. You may not have hypertension, but it would still be useful for you to know what your blood pressure is from time to time. It is estimated that in the United Kingdom, there are about 5 million undiagnosed hypertension. Okay, so there are about 5 million patients with undiagnosed hypertension. That's a lot of people. This means they have hypertension, but do not know about it. And the interesting thing about hypertension is, in the vast majority of cases, it doesn't give any symptoms whatsoever. And sometimes the first time that a person becomes aware of it is if they were seeing their doctor or their nurse and they had their blood pressure checked for some other reason and they found out that their blood pressure is high. Sadly though, some people only become aware of it the first time when they have a major catastrophic health event, such as a stroke or heart attack. And indeed, 50% of cases of heart attacks and strokes are related to hypertension. So if you're perfectly fit and well, you should at least be having your blood pressure checked once every 5 years. And as you get older, perhaps once every year, because hypertension increases with age. If you have got known hypertension, the minimum you should have your blood pressure check is at least once a year if it's well controlled. What your doctor may tell you, give you other guidelines as to how frequently to check it, depending on how well controlled your blood pressure is. Now, there are significant benefits to monitoring your blood pressure at home. Okay, so number one, it helps you get a good control of your blood pressure and of your underlying medical condition. It also helps to check what your blood pressure reading is outside of the doctor's office. There is something called white coat hypertension. A lot of doctors nowadays, because of infection control reasons, do not wear white coats, but this is the term. Traditionally, when patients are in a doctor's office, the doctor wearing a white coat, it induces stress and anxiety, and that raises the blood pressure, and it may really not be their resting blood pressure. So by monitoring your blood pressure at home, you can actually feed back to your doctor what your pressure readings are at home. Now, it also means if you're able to accurately do this at home in a reliable way, with an accurate machine, it can save you multiple visits to your physician, even outside of the pandemic. Now, let's talk about the actual, process of measuring your blood pressure. Well, it starts from, choosing your machine. There are various machines you'll come across in the market. There are machines with cuffs that go around your upper arm. Okay, there are machines that go around your wrist, and there are actually now machines that go around your fingers. Now, definitely avoid the ones that go around your fingers. I mean, they're not particularly accurate. They're not well validated at the moment, so avoid using those. I certainly will not want to make a clinical management decision based on that. Now, I would also encourage you to avoid using the wrist cuff machines because they're not as accurate as the upper arm cuff machines. So the number one recommendation is to use the upper arm cuff machines. And there are automated blood pressure machines that you can use where you press a button and it does the reading. So avoid using the wrist machines if you can. But if for medical reasons you can't use the upper arm machines, then you can use the wrist machines if that's the only alternative. But if you can, absolutely go for the upper arm machines because they're the most accurate ones. Okay. So how do you go about choosing your machines? I'm going to show you a machine that I have here. Okay. So this is, I don't know if you can see it, this is an Omron machine, and that's its cuff. Okay. This is the cuff that goes around your arm. Okay. And this tip here connects to the machine just like that. And as long as you've got the right cuff, you can put this in your upper arm and then press the start button, and you can see it comes on and it starts to take the reading. I'm not going to go through that now just yet. So selecting the cuff is really important because if you select a cuff size that's too small, you're going to underestimate the actual blood pressure reading. If you select a cuff size that's too big, you're going to overestimate the blood pressure reading. So what is the correct cuff and how do you select it? Okay. Selecting the cuff is based on the size of the circumference of your upper arm. Okay, the size of the circumference of your upper arm. So when I say the circumference, what I mean is the distance all the way around your upper arm. The cuff size that you use, they have something called the diaphragm, the bit that actually pumps up. The cuff size, the diaphragm has to be at least 80% of your circumference, of the length all the way around your arm, and not more than 100%. So it shouldn't be longer than the length all the way around your arm because you don't want it to overlap on itself. So it's got to be between 80% and 100% of your circumference. So I know, for example, the circumference of my arm is 40 centimeters. But you can do the measurement yourself with a, this is just a simple tape measure. Just demonstrate for you. Okay, and now you can see why I was wearing a t-shirt today. So you get the tape measure and measure the circumference around your arm. Okay. So that's the measurements. Okay. That's something I know Schwarzenegger used to do and show off in competitions when he became Mr. World, and he goes around and say that he's got a 22-inch bicep. Mine is not that big. But you measure the size of your of the circumference of your upper arm, and then you choose a blood pressure machine with a cuff size that's at least 80%. So if, I said mine is 40 centimeter, 10% of that, of 40 centimeters, 4 centimeters, 80% is 8 times 4, so that's 32 centimeters. So I've got to make sure that I use a cuff size that's suitable, that's at least 32 centimeters, okay? But it's very easy. Now, you don't have to, be able to calculate how many percentage, what's 80% of your arm circumference. You just need to know your arm circumference. And when you go to the shop on the actual box, it will tell you the cuff sizes. So this is one cuff, okay? Here, you can see this here? Yeah, it says this is suitable for cuff sizes between 22 and 32 centimeters. I'm standing, and when you do your blood pressure at home, you should always be sitting down, okay? So imagine I'm now sitting down, all right? So you want to be sitting down. You want to make sure that you haven't done anything that could increase your blood pressure, within half an hour of having it checked. So for example, make sure you haven't eaten, smoked, drank a cup of coffee, cup of tea, anything with caffeine in it, for example, Red Bull, Coke. Make sure you haven't done anything like that. Make sure you haven't exerted yourself within a half an hour of having your blood pressure checked. And when you're ready, take a sit and relax. Relax for 5 minutes, maybe even meditate, but don't fall asleep, okay? Relax. Now, what you want to do is get the cuff. Okay, I'm going to demonstrate for you. You see, we've chosen a cuff, assuming we've chosen a cuff that's the right size for my arm circumference, all right? What you'll find on cuffs as well is they have an ART, okay? This is upside down here. So ART, which stands for artery, and it tells you how to position the cuff, okay? And that is for something called the brachial artery. So this is my arm. So get your arm facing up like so, all right? With your palms facing up, the inside of your elbow region, so this area here is called your antecubital fossa, but the inside, the inner part of your elbow region, just where your elbow is on the front end, lies your brachial artery. This is a big artery that supplies blood down the rest of your arm. And if you feel and press, you can actually feel a pulse. So that's where your radial artery is. So where you see this sign that says ART, some of them might just have an arrow, okay? Some of them might just have an arrow. Where you see that sign, you want to make sure it's positioned over the brachial artery. So I'll show you. In my case, what I'll do is I will position it in such a way, can you see? So the artery is right over my brachial artery, okay? So I'll position it like that, okay? And now this cuff, you can see this cuff is actually using a cuff that's just slightly too small for my arm, all right? But I wouldn't check my blood pressure with this. This is just for demonstration purposes. And you want to make sure that you're wearing a loose top, and that's why I wore a t-shirt today. So you can pull the top back and then get the cuff directly onto the arm. Okay? You don't want to wear a tight top, so when you pull it back, it's squeezing on the arm. That actually gives you a wrong blood pressure reading. You get the other arm of the cuff, the other end of the cuff, and connect it into your machine. Now imagine I was sitting. The next thing I want to do is make sure my arm is at the level of my heart, okay? Now, I'm not going to go through the exact anatomical position of where the heart is, it would be too confusing, but just imagine your heart is in the middle of your upper chest, okay? So you're sitting down, you want to be resting, perhaps you can put a pillow under your arm, and then make sure your arm is at the level of your heart, can you see, okay? And then you press, and just nicely press it out. You should never be talking, like I'm doing now, never be talking whilst having a blood pressure check, okay? So it goes up, and then eventually it will come down. Once it's red and you'll get a reading of the blood pressure. Now, it's important to know, to know how to look after your machine. So the other thing to note is that the machines that we use in surgeries or hospital settings, they're calibrated at least once a year by a highly trained engineer that ensures the reading are accurate. Okay, because machines can sway. Okay, they can move from normal, and so over time they may not be giving you as accurate a reading as possible. So how do you know whether your machine at home is accurate? The first time you get your machine, it's really advisable to take it into your nurse or your GP or your physician, and so that they can check the reading that they get with their calibrated machine against your machine. They're not going to be the same. No two blood pressure readings will ever really be the same, but they'll be closely matched. If they're significantly different on 2 or 3 readings, then you know that you have something wrong with your machine. Okay, and you want to do this going forward once a year. Okay, just to make sure that your machine hasn't gone out of kilter. Well done for getting this one. I bet you didn't really think that measuring your blood pressure could involve this much. I've broken it down in steps, really just to help you understand why it has to be done in a particular way, why you've got to wear loose-fitting clothing, why it's important to know the circumference of your upper arm so that you can choose the right cuff, the right blood pressure cuff for you, why you mustn't have done anything that could raise your heart, your blood pressure within half an hour of getting it checked. So not eating, smoking, drinking alcohol or anything with caffeine, or exerting yourself, doing exercise, for example, making sure you rest for 5 minutes before having it checked. And it's really important to make sure your arm is at the level of your heart, otherwise you get an inaccurate reading. You must always be sitting down, as I said. If it's possible, maybe tricky and challenging during the pandemic, but if it's possible, the first time you get your blood pressure reading done, do it at your doctor's surgery or your nurse, at your nurse's office, just so that you can compare your reading against a calibrated blood pressure machine that they would definitely have, because they get it calibrated at least once a year. That just tells you that your machine is accurate, and you can rely on the readings, and clinical decisions are going to be made on those readings. It's really, really important that they're valid reasons. Okay. Now, if you've gone through this video and you're still struggling, you're still not quite sure how to do a blood pressure reading, speak to your nurse, speak to your doctor, and they will happily show you. Thank you for watching this video. If you've enjoyed it, we ask that you share it with your loved ones and your friends, so that they also benefit from it. If you'd like to be the first to know about our latest videos, subscribe to our YouTube channel, our Doctor to You YouTube channel. And also join our Facebook group. We have a Doctor to You Facebook group that you can join, and we have new updates there all the time. If you're interested at booking an appointment with seeing us at Doctor to You, go to our website at www.drtoyou.co.uk. Have a browse, have a look around. If it resonates well with you, pick up the phone, send us an email, or you can book an appointment directly. You can even order blood test, set a urine test directly online without necessarily having to see a clinician, but a clinician will go through your request and for you to make sure it's appropriate. I wish you all the best, and longevity, good health, and we'll see you next time, and hopefully as a subscribed member to our YouTube channel when we release our next video. Take care.